Pelvic pain is a very common condition in most people. Women especially, because there's a lot of stuff that goes on in the pelvic area. The ovaries ovulate, the uterus goes through cycles, and periods happen. So anything that is persistent and recurrent as far as pain is concerned requires attention. Any pain that is cyclical, let's say every month the pain with periods get worse and worse and worse over a course of several months or years, has to be looked into. But if there's a pain that is daily and is persistent and does not respond to pelvic rest, conservative management like heat or stretches or ibuprofen, and lasts for more than a couple of weeks, that also should be looked into. And a person should not wait for several months for this to address it. So what happens when a person goes to a physician? We look at the pelvic area, we look at the organs within the pelvis, and we see what the likely causes may be. So for example, a pelvic exam requires evaluating the uterus and the ovaries and the lower abdomen with our hands. A pelvic ultrasound is usually a very good addition to a manual exam. So the pain could be from the GI system, it could be from the bladder, it could be from the rectum, it could be from the uterus and the ovaries, and all of that has to be fully taken into account and inspected. So many times the pain is from a chronic constipation, many times from a damage that a pelvic floor has sustained and a person cannot empty their bowels, or the person has hemorrhoids, which initially a person would not think a gynecologist would take care of, but a urogynecologist would. And then there are other more common reasons for pain, such as ovarian cysts, fibroids, which are very common in 60 to 70% of women, endometriosis, which is common, and 15% of women suffer from endometriosis. There are many different conditions that can be diagnosed and treated that cause a pelvic pain condition to become chronic and persistent, and the sooner those conditions are treated and diagnosed, the better.